So, we're diving into 11 supplements that might help lower blood sugar naturally. Have you ever wondered if something you already have in your kitchen, like right in your spice rack, could actually make a difference for your health? Well, today we're going to dig into that, looking at some fascinating research. Let's jump right in. Right, it's a fantastic question. And honestly, it's just the tip of the iceberg. We're going to look at a bunch of natural compounds where studies are hinting they might have a real impact on our glucose levels. Okay, so first things first, let's zoom out and look at the big picture. Managing blood sugar, it isn't some tiny niche health thing. For millions and millions of people, it's a crucial piece of their daily health puzzle. And the research here is super clear. High blood sugar is tied to some really serious conditions. That's exactly why it's so important to work with your doctor to manage it with the right mix of diet, exercise, and any medications you might need. I mean, that's the foundation, right? The bedrock for long-term health. All right, so where do supplements fit into all of this? It's really tempting to look for a quick fix, a magic pill, right? But it's so important to think of them differently. They're not a magic bullet. They're more like a potential tool you might add to your toolkit, a toolkit that's already been built and approved by your doctor. And this right here, this is the key idea. We're talking about a complementary approach. And what that means is super simple. Supplements are used with your main health plan, not instead of it. That distinction is a really big deal, and we're going to keep coming back to it. All right, let's get to the good stuff. The research we're drawing from actually looks at 11 different supplements, but we are going to shine a spotlight on some of the most interesting ones and see what the science is actually saying. Whoa, okay. Look at that number, 48%. That seems pretty significant, doesn't it? But what on earth is it talking about? Let's get some context. So that 48%, it comes from a study on Ceylon cinnamon. And what's really fascinating here is how specific it is. It's not just any cinnamon, it's Ceylon cinnamon. And they mention the exact dosage. It's such a great reminder that with supplements, the devil is absolutely in the details. The specifics matter a lot.
Okay, so from a spice we all know, let's talk about two essential minerals, magnesium and chromium. The research points out a lot of folks with type 2 diabetes are actually low in magnesium, which can lead to insulin resistance. Think of it like this. Insulin is the key that opens your cells to let sugar in for fuel. With insulin resistance, that lock gets all rusty. Magnesium might help, get rid of some of that rust. And chromium, it might just make the key itself work better. It's pretty cool how they might tackle the problem from different angles.
Next up is berberine. This is a compound you can find in a few different plants, and some studies are suggesting it could be a real two-for-one deal. It might help lower blood sugar and, at the same time, give your body's own insulin production a little boost. Okay, probiotics. You might be wondering, wait, how do gut bacteria fit in here? Well, the thinking is that they might help out indirectly. By getting your gut health in balance, dialing down inflammation, maybe even lowering stress, all of that could improve how your body responds to insulin overall. It's a perfect example of how connected everything is in our bodies, right? What happens in your gut definitely doesn't stay in your gut. Okay, we've talked about some of the potential upsides, but now we have to talk about something that's honestly even more important. So I need you to really lean in for this next part because it is without a doubt the most critical section of this whole explainer. Let's just pause on this for a second. Read that. This quote is the bottom line. It's the headline. No supplement ever should replace what your doctor has prescribed. Period. This is the #1 takeaway, and it is absolutely non-negotiable. And the research lays out 3 huge risks you need to know about. Number 1, for a lot of these supplements, the evidence just isn't solid enough for them to be officially recommended. Number 2, side effects are a real possibility. And we're talking serious ones, like potential harm to your kidneys or your liver. And number 3, they can mess with your other medications. That interaction could cause your blood sugar to drop dangerously low. So, we've weighed the potential good against the very serious bad. Where does that leave us? What is the single most important thing you can do now?
It all boils down to one thing, a conversation. Before you even think about adding a new supplement to your routine, you absolutely must talk with your doctor or pharmacist. They're the only ones who know your personal health story. They're the only ones who can give you safe advice that's actually meant for you. And that really brings us to the final question, doesn't it? Our health is not a one-size-fits-all t-shirt. What works as a helpful tool for one person could be genuinely harmful for someone else. And the only way to figure out if a supplement is the right tool for your personal health toolkit is to talk to the expert, the one who knows you best, your doctor.
Thanks so much for tuning in.